My name is Cecilia Chung. I am a resident in San Francisco, and I am also a commissioner on the San Francisco Human Rights Commission. I had a bad experience in the hospital when I first began my transition. I had really severe abdominal pain. I went into the emergency room. They immediately dismissed my symptoms. I overheard the nurse calling me a drama queen. They did not give me any really complete examination and decide to discharge me. They actually escorted me out with a security guard.
It's a sad reality, but LGBT people still face discrimination in healthcare. A study by Lambda Legal in 2010 reported that 56% of lesbian, gay, bisexual patients and 70% of transgender patients experience some form of discrimination. These patients are reporting being refused healthcare, blamed for their health status, subjected to harsh treatment, and physical abuse. The fear of discrimination or discrimination itself lead LGBT people to avoid seeking healthcare, and as a result, healthcare disparities are rampant in the LGBT community.
I endured another long week of excruciating abdominal pain. I went to the emergency room again, to the same hospital. They found out that I actually had developed gangrene already at that point. Had I not gone into the emergency room at that 11th hour, I would have died.
There are things you can do to protect your healthcare rights. Plan ahead. If there is a hospital that you frequent, check out their patient's bill of rights. If it doesn't include LGBT protections, ask them why. Make sure you complete your hospital visitation forms and keep them in a safe place where they can be accessed in an emergency. Complete advanced healthcare directives and make sure that your family knows your healthcare wishes. Also take a look at the hospital visitation policies. Again, if they don't include LGBT patients, ask them why.
I've become more proactive in my own healthcare. I decided when I choose my primary care providers, I made up some questions that I was gonna go through. I asked them about their experiences in treating transgender patients. And that's how I was able to found this wonderful relationship that I have with my primary care provider, and she's been my doctor for over 10 years now. I think it would definitely be helpful had the Healthcare Equality Index been around at the time when I had all my challenges with the emergency room services. It would give me the tool to really advocate for myself at the time when I needed it most. The message to all hospitals, it's really basic. They shouldn't be looking at people because of their skin color, because of their sexual orientation or gender identity. They should be treating people because they are there to save lives. It's their job. When they take their oath, they have taken an oath to save life.